For more on the MPIs and compliance, joining us via Zoom is Dr. Samuel Okarinde, a public health physician. Thank you for joining us on the program.
Thank you for having me.
Nigeria seems to be weathering the pandemic better than some countries, and according to the Africa CDC, we're reporting 19% decrease in cases. However, could it be that there are infections unaccounted for in asymptomatic cases?
Okay, thank you very much, Millicent. Yes, there have been some decrease, but we really can't say that that is absolute. Because if you look at the number of people that have been tested in Nigeria, we've tested just barely about 1.8 million people, less than 2 million, and in a population of about 200 million. So when it comes to testing, we actually haven't done well in that area. Okay, then of the less than 2 million that we've tested, we've had about 164,000 cases. So it means that if you had tested more most likely we would have been able to pick up more cases. But that aside, also because the COVID-19, we've had more of the mild case. So people who have such symptoms will just probably feel they have malaria, maybe with some drugs, and they are fine. So we can't say that for sure we have been doing well in testing, because even that currently now, a lot of people really don't just test. Okay, but by and large, we'll say that we haven't really done badly in terms of COVID-19, basically.
Could we in any way attribute it to the number of vaccinations that we have recorded across the country, impacting reduction in cases?
I wouldn't say so, because, I mean, we had about just about 3.something million vaccines. And one of the issues that we've had is that of those, we've given only just 1.13 million. Of those doses. So I think it's too early to begin to attribute that to the vaccines. I think we can still say, number one, because we have younger populations. Okay, if you compare Nigeria to places like US, like India, where they have more serious or severe cases, Nigeria seems to have a younger population, and so it is quite mild in those populations. Okay, and that is why. If you compare our cases, like I said, we have only 164,000 compared to US that had over 31.9 million. Okay, so I wouldn't want to say, I think it would be too quick to attribute it to vaccine, because the number is quite insignificant.
So give us an idea of your experience, especially with the jab and people receiving them. Would you say that there's no more hesitancy, skepticism towards COVID-19 vaccines?
Okay, so I would say that it is actually a mix. A mix in the sense that we have people who, for example, some health workers who still have their doubts, about the long-term effects of the vaccine, which I would say is normal. Okay, so a lot of people, for example, feel that if they take it, particularly the women, they may not be able to conceive. We still have some of those, even amongst the health workers. Okay, and then we have some who are willing to get the vaccines. They are not health workers, but they are willing to get the vaccines, but for one reason or the other, they can't access it. So yes, on one part, particularly among some health workers, even though a lot of people have gotten it, but the hesitancy still remains. But there is this gap of those who really want to access those vaccines, who really want to get them, but for one reason or the other, they can't get it. So I think it's a mix, kind of.
So thank you, Dr. Samuel Okarinde, public health physician. Thank you for joining us on the program.
Yes, thank you for having me.